So the information that I provided at the time was consistent.
But incorrect.
Well, in retrospect,
As an unprecedented algal bloom swept across South Australia, the Chief Health Officer was keen to reassure the public.
in Florida, where there's a brevetoxin, they think that the toxin is more of a trigger for people with asthma, but we don't have that as a problem here in South Australia.
You basically said, we don't have that problem in South Australia. You said, there are no brevetoxins here.
Yeah. So I said exactly that because that was the case at the time. That was the understanding, the knowledge from the information that we had. Of course, now we can look back because we've collected all of that information. We've been able to check this information.
As a doctor, how can you make such a broad statement to totally dismiss that the brevetoxins cause that asthma?
So I'd suggest, Angus, that wasn't totally dismissed because we continue to follow up. So the information that I provided at the time was consistent.
But incorrect.
Well, in retrospect, of course, we know it's from the Cornea cristata. And as soon as I had that information from that foaming event at Henley Beach, I used the precautionary principle and told the South Australian public about that.
Do you acknowledge that for a small number of people, the symptoms are very serious?
These are non-specific symptoms, so there could be, in certain circumstances, another reason for that, okay? We have not had large numbers or even individual cases that I've been told about of people that have definitively only had the algae bloom bringing them into hospital with these symptoms. But in the vast majority, these symptoms are very mild, minor, non-specific, and they disappear fairly quickly once the exposure goes away.